Depression and addiction rarely happen separately. Many people start using substances to numb emotional pain, sleep at night, or just get through the day. But over time, the same substances that relieve the pain usually make the depression far worse, creating a cycle that becomes harder and harder to escape. Depression is not just feeling sad. It can completely change how a person functions. Someone who once seemed motivated and social may suddenly become exhausted, withdrawn, or emotionally flat. Some people sleep constantly. Others can't sleep at all. Even simple tasks can start feeling overwhelming. One of the biggest warning signs is when those emotional changes appear alongside substance use. Depression and addiction often overlap so heavily that it becomes difficult to tell which came first. A person may drink or use drugs to cope with hopelessness, trauma, or stress, while the substances themselves slowly worsen mood and brain chemistry underneath. There are several forms of depression that can show up during addiction. Major depression can make daily life feel impossible. Persistent depressive disorder can quietly drag on for years as a constant low mood. Bipolar disorder can involve swings between depressive crashes and risky, impulsive highs. Some people even experience psychotic depression, where depression is mixed with paranoia or losing touch with reality. The physical and emotional signs are often missed at first: sleeping too much or too little, sudden appetite or weight changes, pulling away from loved ones, feeling worthless, hopeless, or emotionally numb. In severe cases, people may talk about disappearing or not wanting to go on anymore. When those signs appear together with addiction, the risk level rises dramatically. One of the hardest truths about dual diagnosis is that addiction and depression feed each other. Substance use changes brain chemistry, emotional regulation, sleep patterns, and stress response, while depression increases cravings for escape and relief. That's why treating only the addiction or only the depression usually doesn't work long term. Both conditions need to be treated together. Recovery often starts with medical detox if substances are involved, followed by structured dual diagnosis treatment that addresses both the emotional pain and the addiction underneath it. The earlier someone gets help, the better the outcome tends to be. Because while depression and addiction together can feel overwhelming, both are treatable, and people absolutely do recover every day.